So fat grafting in itself is permanent. The issues with it are that not all of the fat stays or survives. So what we're talking about is doing liposuction of fat from one area and then putting it in another area like the breast or more commonly the butt for what's called a BBL or Brazilian butt lift. That's the only other way you can really get volume compared to an implant. Again, only about 50 to 70% of it actually stays. What does stay stays long term. You just don't know exactly how much of it is going to stay. And so that can potentially cause issues with asymmetry if it stays more on one side versus the other. Some people need multiple rounds of fat grafting to get you can only put in so much fat at one time to have it safely survive. And so some people need multiple rounds of it. So that may be more surgery. Also, it may cause changes on mammograms. It may cause like cysts or scar tissue, things like that, that may make it where patients have more need to have biopsies if there's something irregular seen on mammogram. So there are all these considerations. I know on paper it looks like the kind of perfect treatment. And then also, if people are looking for that volume more in the upper pole here, it's really hard to achieve that with fat by itself. That wants to kind of act more like native breast tissue and kind of round out the lower pole. So for volume, in my opinion, implants are definitely a more reproducible way to go because you know exactly the volume you're putting in. It's going to be symmetric. Um, so yeah, it does get a little more complicated, but the short answer, whatever does survive tends to last, a pretty long time.